let's get started and have a good meeting here this morning. First of all, please turn your cell phones off so that you don't intrude into the program. I think, as everybody knows, and if you don't know, I'm going to make the point very clear this afternoon that back care and prevention of back pain is very critical to our company, both from a workers' comp standpoint and from a wellness standpoint. And we're working both of those issues very hard. One, not to have workers' comp claims. Two, to be more physically fit and more well. And care and conditioning of your back can make you feel better and be better and prevent accidents. And so with that, I want to thank Carrie Getz, who's over here in the turquoise, for putting this program together. And Alice Oldham also helps on the wellness programs for the clinic. Clinic's videoing some of this for their purposes, and Marla's going to video some of this for our purposes. We're hoping to take this to our out-of-town locations, which, you know, in Dodge City we only have 5. In Salina and there'll be 5, Topeka 4, and Olathe 20, and to do this same back wellness program. Again, back problems, both from our workers' comp standpoint and from our health insurance standpoint, has been an extremely big cost to the company. And when we have cost to the company, either in workers' comp or health care claims, it takes the monies that are available to do other things, including wage increases and other benefit programs. So it's in all of our interests, mine, yours, everybody's within the company, to do as good a job in wellness and health care as possible. So with that, I'd like to introduce Mark Hall, who is the Director of Physical Therapy. And Mark, thank you very much for making this presentation today.
Oh, you bet. I'm going to have my staff come out there hiding behind the door. Well, welcome to the Hutch Clinic. We're going to get through this presentation today as painless as possible. I know back pain is a big topic. I've been a physical therapist for 12 years. I've been here at the clinic for 11, and I've seen my fair share of back pain, back injuries, and whatnot. So we'll go through this, and then after we're done, we have a little treat for you guys. We're going to go into the department here, and my staff, and I have 2 students here currently, so they're the poor timing award, I guess, of getting involved with this. So we're going to put you through some exercises and some things today. So get a little hands-on action as well. As far as back pain goes, research will tell you somewhere between 80 and 90% of the population in the United States will experience at least one episode of back pain in their lifespan. That's pretty much everybody. Beyond that, though, is the next piece of research that says within 6 weeks that pain will probably resolve no matter what you do. So you're probably right there thinking of, well, what the heck are we doing here if it goes away? The problem that comes down to is that people have repeat episodes. So the first episode they have, 6 weeks ago, goes away. It's those ones that comes back again, again, and again. What you'll see sometimes, too, is when it comes back, it stays on longer, gets worse, and then you have another episode that stays there longer, gets even worse, until you have the big whammy, and then you have some serious problems. So even if you've had back pain before, you can still do some things to maybe offset the potential for it returning and coming back and being a bigger problem for you down the road. So research is one of those things that it indicates that things you do in treatment of back pain may or may not be that big a deal, but doing something for it is very important. Now, as I go through this presentation, I put some slides up here. We're going to talk a little bit about anatomy. I know everybody doesn't have a medical background, that's fine. I'm going to try and make it as simple as I possibly can, but I think it's very important for you to understand some of the things that the human body does and can do to offset the problem of back pain. If anybody has any questions at all, do not hesitate to ask me, stop me, interrupt me, throw things at me. It doesn't bother me one bit. If you want to talk to me afterwards, I'll be around. So if you don't want to speak up in front of the crowd, feel free to grab me afterwards. I'll be here. So I love questions. I love talking about things, but I don't want to bore you to tears either. So I could probably stand here all day and talk about this stuff, but I know everybody wants to sit through it. So having said that, we'll get rolling here. If this thing will work, I think I just blew through a couple slides too. It's a good start. We're going to talk about anatomy first. Bone, which is the vertebrae, is the individual segments of the spine. And this picture here, you guys can feel free to get up and move around too if you can't see all that well. If you need to dim the lights too, just let me know. On on the left side here, you're looking at a spine from the front. On the right, you're looking at one from the side. Now, the one on the left, you can see the levels, and there are actually numbers on there, and they're pretty small, so you may not see them. But the first vertebrae up top from the head down to number 7 is the cervical spine. Now, number 7 is that little bump back here between your shoulders, a little above your shoulders back here. That's C7. That's the cervical spine. Now, below that is the thoracic spine. It runs through 12 segments, and then below that is your lumbar spine. L4, L5, which is lumbar level 4 and 5, L being the descriptor there, is where you see a lot of your problems, and we can talk a little bit about that as well. But L4, L5 will probably be about your belt line for most people. Below that is the sacrum, and below that is your tailbone. All right? Now on the right side, what you'll see is a little bit of a curve of the spine. A curve of the spine is natural. You'll hear people talk about scoliosis, which is a curvature of the spine as well. But these curves right here actually contribute to the support that the spine gives the body. It has one of those things of offloading force, being able to absorb force. So it's one of those mechanical things that the spine is able to do, or is designed to do. So it's kind of unique if you look at it from the standpoint of anatomy. Now this is the lumbar spine, and we're looking at it from the side. There's 5 levels, 1 through 5. In between each bone is what's called a disc, and this is what you may have heard about before. If anybody's had any disc problems before, that's the area between the little gray area there. Now the back portion there, the little bone wings or things that stick out, those are things you can feel if you poke down your spine, the little bony prominences that are sticking out. So that's what a lumbar spine looks up close and personal. And you can see it's got a little bit of curve to it as well, like I showed you on the previous slide. Okay, now the intervertebral disc, or disc, has 2 parts to it, and I'll show you a picture, actually 2 pictures here. One's called the annulus, one's called the nucleus propulsus. The annulus is more the outer portion, the inner portion is the nucleus propulsus. The difference between these 2 areas is basically the makeup of the material that it has. They're made of the same thing, but the annulus is designed to be a little stronger on the outer portion. The nucleus is designed to be a little bit more mobile on the inner portion. So they're made up of the same stuff, it's just a different combination of it. Now, they also have what's called they have a high water content. They're hydrophilic. They love water. Now, this is important if you've ever had back pain before, because what will happen sometimes, a common complaint is somebody will have a problem during the day. They will go home at night, lie down in bed, and what happens when you lie down, gravity will not have as big of an effect, and the water can actually absorb into the disc. Now, if you've had back pain before and you've done this, you try to get up the next morning, you can't get out of bed because the disc has been injured in some fashion. It has absorbed water, expanded a little bit, and put pressure on that pain-sensitive area that's been damaged. Then you go to sit up or stand up, compression comes back down, gravity comes back down, puts pressure on the disc, and that doesn't feel very good. That's a very common complaint with patients when they come in. Well, it didn't bother me yesterday, but I couldn't get out of bed today, and that's why, because of that water content. Now, because of that, the diffusion of nourishment is very important. The disc does not have direct blood supply. It doesn't have arteries that run right into the disc. So what it does to heal itself is use of diffusion. So water movement in and out of the disc. Right? And basically what that means is you need to move to keep your disc healthy. And that plays right into the whole thing of exercise, position changes, and things I'll talk to you about here in a little bit. Now, an also important part is the disc itself attaches to the vertebrae above and below. They're actually locked on. And this is a big thing. I'll show you another slide here as far as talking about slipped discs. So there's your intervertebral disc. Now, actual pictures of it. This is a drawing. You can see the delineation there of the annulus and the nucleus propulsus. It's not that simple, though. It's not this part is the annulus, this part is it kind of bleeds together a little bit in terms of the actual makeup of. This is a cadaver picture of the disc. You can see they put numbers on there to kind of delineate where things are, but it's kind of hard to differentiate which is what part. That's an actual disc. Now, number 3 up there is actually called a cartilage end plate. That's a thing, too, I'll talk about here briefly as far as what you may feel if you've ever injured your back before. So there is an actual disc. That was probably taken out of an autopsy, probably within a few hours the picture was taken. So that's a pretty fresh picture of a disc right there. Now the nervous system, we've got to talk about nerves. This is looking at from the backside, I believe. But you can see the spinal cord runs up and down, and then on each level of the spines where you saw the vertebrae in the previous slide, there's nerves that exit out just like tree branches. Now, if you come down low on the picture there where your belt line will be, where your hips are sitting, that's where it kind of branches out into the legs. Now, the big chunk over here on the left, is obviously they didn't draw this in on the right, is where your sciatic nerve would run. I'm assuming most people have heard of sciatic or sciatic nerve. Now, the important part here is you see where the nerves branch out at each level. So each level, the nerve sits there, so if you have some type of insult or injury to the disc, the nerve is susceptible to irritation, and this is where you would probably get some of your numbness, your tingling, your leg pain, it's called radicular pain, the symptoms that run into the lower extremities or the legs. And that's why, because of the nerves that exit out. Now the spinal cord sits in the center, so if you have an insult to the disc that puts pressure or irritation backwards, straight back, you can actually compress and irritate the spinal cord. And then you're talking about having your problems where you can't pick your feet up, you're tripping and stumbling, you actually have problems with your bowel and bladder control. That's a medical emergency. And that's a big deal. So if you have any of those symptoms, you need to see your doctor ASAP or get to the emergency room. Okay, so we're going to move on to muscles. Now everybody knows about your abdominals, but as far as importance to back pain or back stability, they are a big time player. And this picture will kind of show you why. On the right side of this picture here, you see the up and down muscles right in the area of the abdominals. The rectus abdominis is the big washboard muscle that you see in the magazines and whatnot. And everybody would love to have a set of a six-pack, but it's not always possible for everybody. But when you look at the muscle orientation, it runs up and down. Those muscles have a hard time stabilizing the spine because of their orientation of going up and down. If you've ever seen the big radio towers out in the middle of nowhere, what do you see with them? You see the big guy wires that come down, they come off at angles. That's the way they can control that tower from it moving around. If they went straight up and down with the tower, you'd have no stability. The spine is the same thing. The spine is a radio tower, muscles are the guy wires, but the rectus goes up and down. So it's more of a mover versus a supporter. Now, if you look on the left side of this picture here, you see the abdominal muscles coming in at an angle. That is basically your oblique muscles right there, and they attach basically in the front, right? Now, the next slide, I'll show you where they attach in the back. But that's an important thing when you talk about doing exercise, and it's not just about doing sit-ups. Most of my all of my patients I have with back pain, I never show them sit-ups. We're going to show you some exercises later, but this is a reason why, because the rectus doesn't have a big role in terms of stabilizing the spine. Okay? So you can have your six-pack, but it's one of those things, if you don't have good support of the other abdominal muscles, you may or may not have back pain in your future. All right? Now, this next picture here is looking at it in a deeper level. So the same picture we had, we just cut away some muscles. On the left side, again, now is the muscle underneath the internal obliques. This is called the transverse abdominis. It's a very deep muscle. It's a very big player in terms of support of the spine. We'll do some exercise today that you will actually contract this muscle. We'll show you how to do it. Now, the back muscles are pretty big and powerful. This is a level. If we took all your skin off, this is what you would see. On the left side here, you see what's called the latissimus dorsi muscle, and then that white area in there is a bunch of tissue. If you look at the rear end there, that's the gluteus maximus, and I'm assuming everybody knows what the gluteus maximus is. But you can see where it attaches up close to the belt line. So there's some big muscles in there that help support the spine as well. Now, this next picture is a cutaway from that picture, and you can see again, there's back muscles that run up and down the spine. We just talked about the muscles in the front of the abdominals running up and down. So they're not really geared to support the spine the way it needs to be supported. Now, if you look on either side of this picture, right about the belt line, you see muscles coming around from the front and attaching in the back. These are the muscles I showed you in the front, the internal obliques and transverse abdominis. So they actually attach clear in the front, they run around attaching the back. So what do? They perform a corset-type bracing aspect of the spine. How many people wear back braces at work here? Anybody? Anybody at home wearing them? Yeah. These muscles do the same thing a back brace would do, but they do it better because that's what they're designed to do. Right? So you can see the important aspect there of some abdominal muscles. Now the hamstring and gluteals, this is your legs. Here on the left is an actual superficial picture that we did. You take the skin away and you see the big gluteus maximus muscle there. Up and down is the hamstrings, comes down and attaches below the knee. You cut that away and you see some hip muscles. Again, the orientation of those hip muscles is more at an angle. So your hip muscles actually provide some support for the pelvis and the spine as well. And that's a big thing when you start talking about exercise in general, but also recovery from injuries, rehabilitation, and whatnot. All right? And I think the next one. Any questions on the anatomy there, real quick? I know that's all fun and entertaining for everybody. gives you kind of an idea of what muscles are doing on your spine and why they're important. And if I don't see it, you're ready to just haul it out. Now this picture, this slide right here, I just threw together. It's called what the force couple on the pelvis. The triangle is your pelvis. If you're standing sideways, in the front would be the abdominals. They're going to pull up basically in a sense. The hip flexors, your hip muscles are going to pull down. So you can see where the pelvis should stay level if the abdominal muscles and hip flexors are working against each other. On the back, you have the back extensors, your back muscles pulling up, hamstrings pulling down. So those muscles right there are trying to keep the pelvis nice and level, and then ultimately the spine. So if you have weakness in one group or tightness in another, that may change the position of it and put you a little bit of a risk to increase or change the force on the spine, and in theory have some problems. So that gives you a little idea there. Now, what's the spine actually do? The first thing it does, first and foremost, is protect the spinal cord. If you don't have spinal cord, functioning spinal cord, it doesn't matter what happens next. So the bony protection there, that is very important. Support. If you didn't have a spine, we'd be big blobs on the floor, and we wouldn't be able to do the things that we do as far as at work and at home, fun things we like. Force transfer. It actually takes the force that we apply on our body. So if you're lifting things, pushing things with your arms, the force is then transferred throughout your body so it doesn't load one specific area. And I always tell patients too, if you went up to somebody and you took your thumb and you poked them in the shoulder, it probably wouldn't feel good. If you take your whole hand and push on them, it may not bother them much. Same thing here, spread the force out. And this is just how the body's designed. But it also does it for the lower body. Walking, squatting, stair climbing, it transfers that force throughout the body. The spine allows you to do that. And then movement, which is the big one. Facilitates motion with the upper and lower body. When you walk, the spine allows the arms to swing, allows the legs to swing so you can propel yourself and do all those things that we want to do. Sometimes we take for granted, we don't think too much about it. But the spine allows you to do that. All right, now movement versus stability, or mobility versus stability. These are what's called single plane motions, bending back, forward, side, turning. We do these motions occasionally throughout the day, but not too many people walk around like a robot. So we don't just go one motion, one plane of motion. We'll do combined motions. So we'll do bending and twisting, or leaning back and twisting, side bending and rotation, and things along those lines. So the spine itself has to be very stable to protect you, but also mobile to allow you to move and do the things we want you to do. That's a tough trade-off when you start talking about physics and things along those lines. If you were to design a machine that could produce the movement that we have and do the things we do, you probably would end up with some serious problems mechanically, just like we end up with things physically, problems physically. Now this slide right here, I have no idea where I got it, I can't remember. It serves a purpose anyway, showing you some pressure changes in the disc. It's at lumbar level 3, which is not all that common in terms of injuries. You usually see it a little bit lower in the L4, L5 range. But again, it gives you some idea of the pressure increase from doing these activities. Now, bending forward, you can see it's a 150% increase in pressure at the disc at L3. You're probably thinking, holy cow, that's a lot. But guess what? The body is designed to do that. The body is designed to absorb that force. So it's not necessarily abnormal. It just shows you the amount of pressure that can occur at that level. Now, the bottom two, this is where you're lifting a 20-kilogram weight. The first one shows you with back straight and knees bent. This would be more of a quote-unquote proper lifting technique. So a 73% increase. So you can see where that would increase some, but again, it's not outrageous. The next one is you're lifting with the back bent and knees straight. So you bend at the waist and pick that up. You see about 170% increase there. So you're seeing quite a bit increase in pressure. Again, can the body absorb that? Absolutely. Does it want to do it all day? Probably not. You're kind of playing with fire as far as lifting in that manner. This slide kind of goes along the same lines. You can't see it very well. I apologize for that. But the middle one, the one that goes all the way up top, it says lifting wrong down at the bottom there. I'm not really sure what lifting wrong means, so to speak, but I'm assuming it means bending at the waist and not bending your knees. You can see where that rockets up there quite a bit. But even lying down, the little short one down here kind of on the right, it shows a little bit of an increase in pressure. So there's always pressure there, but it goes up incrementally if you do certain activities. So that kind of gives you an idea of the pressure that is involved in the spine when you do certain activities. Okay, now we're going to talk about problems with the spine. This picture is not very good. It's an x-ray of a spine looking at it from the side. That's not a normal spine if you aren't quite sure. The top portion of the vertebrae, you can see where that's collapsed down. That should be more solid straight across like the one below it. I put this on here because it's a good indicator of what can happen in the spine as we age. Now, bone loss is one of those things that can occur pretty young in terms of age. You start to see it at 25, 30 years old. Now, that's not abnormal. The body, when we're really, really young, if any of you have children, in the teenage years even, they're still growing, they're still maturing as far as their actual height. And that's what happens. The body will produce bone and allow us to grow in height. Once you hit 25, 30, 35 years, that process will now level off to where the body produces bone still, but guess what? It reabsorbs the bone so it levels, so we don't continue to grow. Then when you hit 40, 45, 50, maybe even 60 years old, that process reverses itself a little bit. So the body won't make as much bone, but it will absorb more bone, and we may actually shrink slightly as we age. And if you know of some grandparents or elderly, they may say, well, I've lost a ½ inch or so of height from the last 5 or 10 years. That is one. Again, that's not necessarily abnormal. Osteoporosis, however, is an advancement of that, and that is abnormal, where you see an increase in bone loss, and it can lead to problems like this x-ray you see right here. Now, in terms of discs and back problems, if you look at those vertebrae right there, the in-between where the disc sits, you see where that bone starts to arc a little bit. And as I told you on a previous slide, the disc actually attaches above and below. So it's hooked into that bone. So when it starts to arc, guess what it's going to do? It's going to change the position of that disc and ultimately alter its ability to withstand force and move. And that's a problem. So just by getting older, our chances of back problems go up. Now the next thing that happens, you see a decrease in water content in the disc as we age. Again, this is a normal process, but if it's not as mobile with fluid, it becomes more rigid, so therefore it can't withstand the stress that we apply, and you run the risk of damaging it as well. Previous injuries. If you've ever had a previous injury, you may have damaged the spine to some degree, and that sets you up for recurring injuries. So you have decreased stability, the disc may not be able to function properly, the bone's been damaged, some other structures in the spine may have been damaged as well. Repetitive mechanical stress. If you do things over and over and over again, the body will adapt to that, and not necessarily in a good way. You put all those things together, and you can see as we age and do things, we may be setting ourselves up for big problems. Now, there is a genetic potential to this as well. Some people who have had parents or grandparents with back pain, nobody really knows at this point exactly what role that plays, but there is a possibility. I kind of believe there is some value to that. I just don't know to what degree. And if we do find out, what do we do about it anyway? There's a lot of political and legal, moral issues and things along those lines as far as genetics go. So, but it is a possibility. Now, the last little bullet point there, this is a study I found. It was just kind of interesting. Miller et al. Did 600 autopsies, and it didn't state whether they had back pain or not prior, but it showed that 90% of those people that they did autopsies on, they had signs of degeneration in their discs by the age of 50. Now, is that abnormal? Not necessarily. As we just talked about some of the things that changes in the spine, it may actually be a normal process. There is recent research, and I say that within the last probably 5 or 10 years, that shows they've done MRIs and things on adolescents and teenagers, and they're showing signs of degeneration in their disc as well. Again, is this a normal process or something that is problematic? We don't really know. Nobody really knows at this point. So, but just because you have an MRI that shows you have degeneration of the disc doesn't mean you're not going to get better, and it doesn't mean you have to have back pain. So it's one of the things you got to take with a grain of salt when somebody says, my MRI showed this, this, and this. It may not actually be a player in what you're feeling or being limited by. Okay, so now injury, what happens? Typically in a position of flexion and/or rotation. So you are bent and twisted. That's a problem for the spine because it's something that challenges it as far as the stability, to be able to do that motion, but also be stable. You'll see that quite a bit. Somebody bent over to pick something up, raised up, twist a little bit, and then you have a problem. It's not necessarily the activity. It can be the position. I've had patients come in and say, oh, I just bent over to tie my shoes and felt pain in my back. Was it because they bent over to tie their shoes? Well, they do it every day. Or was it more of the straw that broke the camel's back type of theory? So it's one of those things you can look at from what you do, but also how you do it or what position you're in when you do it. Time of day, we talked about the water content of a disc. Lying down at night where the disc absorbs water, as you sit up and stand, it compresses it, so you actually may lose a little height as your day goes on. So the disc has less water content, maybe becomes a little bit more rigid towards the end of the day. and then you have problems at the end of the day. So typically I'll ask patients if they do get hurt at work, did you just get there, have you been there a while, as far as the day goes. Gives you a little clue sometimes of what may be going on. And then with the body's response, just like you sprain your ankle, hurt your knee, you're going to get swelling, pain, heat, spasm, limited motion, combination of all those. Problem with the spine is, guess what? There's not much room in there, and as I showed you on the picture with the nerves, there's some pretty pain-sensitive structures in there, so you get a lot of swelling, some irritation in there, you're going to have some problems. Okay, now specific injury to the disc, you can have trauma to the outer portion, which is the annulus, or the disc as a whole. You can actually have tearing of the fibers of the disc, and that sets off that inflammatory response or that pain response, like I just said, with an ankle sprain. You get swelling, you get all those things. What the autopsies, research, whatever will show you is that disc may change its orientation. It may become more of an inflammatory soup. It's not as stable as it used to be. It kind of turns into more of a liquid form, and then it can start to ooze. And when it oozes, it will go to areas of space, which is outward. And again, your nerves are outward to the side, your spinal cord's to the back. So if you have a significant injury, you can create some of that inflammation that causes some serious problems. So it's one of those things, depending on your symptoms and your actual injury, you may have little pain, you may have a lot. You can have just soreness and stiffness in the spine. You can have it all the way down into the leg, the radicular symptoms with the numbness and tingling. Now this is what's called a lateral shift. These are the ones that are easy to pick up when they come into our department. They're sitting in the chair, they go to stand up, and they can't make it all the way upright, and they're kind of hunched over leaning. That right there is a pretty good, almost a dead-on indicator that they've got a disc injury or disc problem. What the body is doing there is trying to get away from the pain or create space in the spine so the disc doesn't have as much pressure, or the nerves for that matter have that much irritation on it. So if they have a disc that bulges or herniates or whatever to the left, they may turn and lean to the right just to create space, to get off of those pain-sensitive structures. So if you've ever had one of these or seen somebody with these, it's pretty obvious. Now this one here, people talk about slipped disc. I get this quite a bit from patients that, oh, I slipped a disc. Well, you know, in general terms, that's not a big deal, but it's actually incorrect because you can't slip a disc in terms of just a back injury or a disc problem. And again, I showed you in the previous slide, I told you that the disc attached above and below to the vertebrae, so for the whole disc to slide out, you'd have to rip it apart from those two pieces of bone. And that's a big problem if you get to that stage of injury. You're probably not going to be walking into the PT department saying, I have back pain. You're probably going to be in the hospital facing surgery. Now, one way you can slip a disc, though, is actually have a fracture in the spine, which is called a spondylolisthesis. And you see the third picture on the top there. There's a fracture through the back portion. The vertebrae itself can slide forward with the disc attached and cause some problems. And if it slides far enough, guess what runs down the center of it? The spinal cord. So you actually create some pressure on the spinal cord and have some serious neurological complications. So it's something in terms of what you say, it may not be that big a deal as a slip disc, but I always like to educate my patients about, hey, you know, that slip disc is not really true. Because there's some treatment things too. People say, well, just pop it back in there. Well, guess what? It's not that easy. Right? You go popping around in an injured spine, you may not be all that excited about it. Now, you talk a little bit about your symptoms. You can have an immediate or a late onset. Immediate pain, you can have the soreness, stiffness. You can actually have the radicular symptoms of pain to the leg, depending on the amount of damage you create. The late onset goes back to, again, with the disc absorbing fluid overnight. It may take you a day, 2 or 3 to come on. That's where those people can't get out of bed the next morning and wonder what the heck happened. You can also have a pop, tear, pull, or catch. You can have a tear of the cartilage end plate. That actual disc picture I showed you where that number 3 was sitting up there and I said a cartilage end plate, you can actually break that. And that's where you may feel a pop or a tear. And I have patients that have told me that, and you may have experienced this too. You bend over to do something, boom, you feel pop, and what was that? It doesn't necessarily hurt at the time, but it can cause some serious problems shortly thereafter. The pull and catch sensation, same thing. You can actually have some tearing of some muscle fibers. You may have some spasm of the muscle fibers. You can tear or stretch some ligaments. There's a lot of things in the spine that you can irritate and make your life not fun. Again, soreness, spasm, pain, all the way to the radicular symptoms, which is the leg down, pain down the leg. Now, you'll see patients who are functional, limited, and non-functional. And what that means is functional. They have a little back pain. They can do everything they want to do. Maybe, it just kind of aggravates me a little bit. It doesn't really slow me down. You have some limited patients where, I just can't do these 3 things. Everything else I'm fine. Or the non-functional where they come in, they're bent over, and they just can't even breathe because it hurts so bad. So it'll vary in terms of severity of the injury and the body's response to that. prevention, that's a bad term. I've been needing to change that word prevention. It should be reduction. You're never going to prevent injuries. We're human. We move. We do things. Things happen. But you can reduce those potential for it. Movement is your best friend. We talked about the disc and the water absorption in and out. It needs to move. It needs that nourishment in and out through compression distraction, which is basically moving around during your day. Alternate activities. Don't do the same thing over and over and over and over again. In the workplace, that's tough because some jobs you're doing the same thing over and over and over again. But if you can modify it and get out of the same positions you're in all day long, you're going to have probably a little better chance. Limit your duration of activities. Take breaks. Go do something else for a while. If you're sitting for a while, go stand up and do something else. If you're standing for a while, go sit down and do something. Just that change in the position, that movement of the spine and disc. And then fitness. Now, weight loss, I get this a lot. If I lost 20 pounds, 50 pounds, would my back hurt? Well, maybe. Weight loss is one of those pieces of the puzzle. It's not the single thing. Olympic athletes, professional athletes have back pain. They're not necessarily overweight. They have other issues. So it's not just the one magic bullet that you're looking for. But yes, if you had a little reduction in your weight, you have less stress on your joints and potentially your spine. So yes, it does play a role. You may return from injury a little bit quicker if you're a little bit more fit. Can't guarantee that. You may actually reduce the amount of trauma to the spine if you do become injured because you're more fit. And then strength and flexibility are always a good thing, not just for back pain. Okay, we're going to talk about lifting mechanics a little bit. We're actually going to do a demonstration where you guys get to try this if you so desire. But the first thing I always tell people when they talk about lifting is, why can't you push or pull? It's easier to push and pull than it is to lift. You just avoid the whole stress. Now, you're not going to eliminate the possibility because you're still pushing and pulling, but the stress is probably going to be a lot less than lifting. So that's the first question. Now, if you have to lift, some things you need to keep in mind. Contract the abdominals. I told you we're going to walk through the abdominal contraction here in a little bit. The best way I can teach the patients to do this is to tell them to hold their pee. Act like you have to go to the bathroom and hold your pee. That will actually contract the abdominals to some extent, create that corset or that back brace effect of the abdominals, and give you some support. Establish a wide base. It doesn't need too wide. Get yourself a little wider, just so you have more force to be able to apply to the lift that you're doing. Keep the object close to your body. It's a lot easier to hold something in here than to stand out here in front, plus the stress on the spine is more out in front of you. Use your body to lift. Use your ankles.